Science shows that alcohol doesn't just affect your brain for a few hours, it directly interferes with testosterone production, blood flow, nerve signaling, and sexual performance. What alcohol really does to your libido, backed by biology, endocrinology, and real clinical data. Point 1. Alcohol suppresses testosterone at its source. Testosterone is the primary driver of male libido, sexual desire, and performance. Alcohol interferes with testosterone production at multiple biological levels. First, alcohol directly damages the Leydig cells in the testes, the cells responsible for producing testosterone. Studies show that chronic alcohol consumption reduces both the number and efficiency of these cells. Less testosterone is produced, even if your body wants to make more. Second, alcohol disrupts the hypothalamic, pituitary, gonadal, HPG axis. This hormonal signaling pathway controls testosterone release. Alcohol suppresses the secretion of luteinizing hormone, LH, which normally signals the testes to produce testosterone. Without LH, testosterone drops, sometimes dramatically. Third, alcohol increases aromatase activity, an enzyme that converts testosterone into estrogen. This means not only do you produce less testosterone, but more of it is converted into female hormones, leading to lower libido, reduced erections, fat gain, and even breast tissue development in men. Even moderate daily drinking has been linked to lower total and free testosterone levels. Over time, this hormonal imbalance translates into reduced sexual desire, weaker erections, slower recovery, and reduced confidence. Point 2. Alcohol damages blood flow and erectile function. An erection is not just about desire, it is a vascular event. Alcohol has a direct and negative impact on the cardiovascular system, which is essential for erectile function. In the short term, alcohol acts as a vasodilator, relaxing blood vessels. This may create the illusion of improved blood flow. However, this effect is temporary and deceptive. Alcohol simultaneously reduces the ability of blood vessels to maintain pressure, which is crucial for sustaining an erection. Chronic alcohol use damages the endothelium, the inner lining of blood vessels. This reduces nitric oxide production, a molecule essential for penile blood flow. Without adequate nitric oxide, erections become weaker, less reliable, or impossible. Alcohol also increases blood pressure, promotes arterial stiffness, and accelerates atherosclerosis. All of these reduce penile circulation, often years before heart disease symptoms appear. Clinically, alcohol-related erectile dysfunction is one of the most common and underdiagnosed sexual disorders in men over 40. The damage is often progressive and can persist even when testosterone levels appear normal on paper. Point 3. Alcohol disrupts the brain-libido connection. Libido begins in the brain. Alcohol alters neurotransmitters that regulate sexual desire, arousal, and motivation. Alcohol increases GABA, a calming neurotransmitter, while suppressing dopamine, the primary driver of motivation, pleasure, and sexual desire. Over time, the brain becomes less responsive to natural rewards, including sex. Chronic alcohol consumption desensitizes dopamine receptors. This means more stimulation is required to feel the same level of desire or pleasure. Many men report reduced interest in sex, difficulty becoming aroused, and emotional numbness. Alcohol also interferes with REM sleep, which is when most testosterone production occurs. Poor sleep quality leads to lower morning testosterone, reduced libido, and chronic fatigue, a silent libido killer. Additionally, alcohol increases cortisol, the stress hormone. Elevated cortisol directly suppresses testosterone and increases anxiety, performance issues, and sexual avoidance. Point 4. Long-term alcohol use accelerates sexual aging. From a hormonal and sexual standpoint, alcohol accelerates aging. Long-term alcohol use increases oxidative stress and inflammation, damaging tissues involved in hormone production and sexual response. It contributes to testicular shrinkage, reduced sperm quality, and loss of sexual vitality. Men who drink heavily often experience early-onset hypogonadism, a condition normally associated with much older age. Libido declines faster, recovery slows, and sexual confidence erodes. The good news? Reducing or eliminating alcohol can partially reverse many of these effects. Testosterone levels often rise, sleep improves, blood flow recovers, and libido gradually returns, especially when combined with proper nutrition, exercise, and sleep.